All right, back on Morning Line. It's our final segment on this Monday. Thanks, everyone, for joining us. Appreciate you watching. And if you want to join the conversation, got the number I'm looking on the screen there, 737+. Chad Givens with us, veterinarian. And we got some folks that waited through the break, so let's get to them. We'll go to Betsy. Hi, Betsy.
Good morning.
Good morning.
Morning. How are you?
I'm fine, thank you.
Good, good. What can we do for you?
Good morning. Listen, I have a dog that is old. She's probably 14 or 15, and I rescued her from someone had dumped her years ago.
Okay.
Back during the ice storm, one of our ice storms.
Yeah.
And she's got several health problems, and one of them is that she's losing her eyesight and her hearing. She can't hold herself up very well. You know, she's small, very small, like a little terrier dog. And when she eats, I have to sit in a chair with her and to hold the foods because she can't really stand on her feet that long. Her legs kind of give out. And in other words, she's really old.
Yeah.
And my vet said that he diagnosed her, she's also got breast cancer and head trauma. And she doesn't run, but she walks around in circles a lot. And I can tell that she's beginning to ache and pain even more. And I was just wondering if I could give her any, I've heard this, I haven't done it, but I've heard that you can crunch up a little aspirin to put in her food. Is that safe for her pains, or is that something you shouldn't do?
Well, what I would tell you is that there are definitely, if your veterinarian feels like an anti-inflammatory would be beneficial, there are a lot more effective medications than aspirin. There is a dose you can use, but you know the way aspirin works is, you know, with your COX-1 and COX-2 pathways for anti-inflammatories, is it blocks both, but it doesn't block enough of the more of the inflammatory pathway, and it blocks more of your GI protective mechanisms. So what you'll see is you can get some improvement, but you won't get as much improvement as some of the more prescription-based ones, and you'll probably get a little bit more GI irritation than you would. So I definitely wouldn't recommend you give an aspirin. I would recommend you ask your veterinarian. If your veterinarian wants you to use an aspirin, that's fine, but since I don't know your animal personally or you personally, I wouldn't make you a dose for you. But what I would tell you is quality of life by far is the most important aspect of owning an animal, and I think that, you know, you need to think that, and I think you are thinking that, and you're thinking, well, here's pain, I need to do something for pain. You know, and there's other things going on with the circling, whether there's a brain tumor or head trauma or vestibular syndrome, which is like vertigo in older dogs, whether you've got severe arthritis, whether you have some GI issues or kidney issues, you know, whatever it is. I mean, you have to balance things. If there's organ issues going on, GI or liver or kidney, then the non-steroidals aren't the easiest on those organ systems. But if there's severe arthritis going on, non-steroidals are by far the most effective medication. So that then puts you in the quality of life again. Say, okay, I know the body's aging, I know that some things are failing, but I want to make sure that my animal's not painful. Then you have to talk to your veterinarian and make a decision. Do I use a drug that could have side effects for these other organ systems, but most likely will cause pain control?
Yeah, she has so much going on. One thing will help, but maybe cause damage the other way. What about glucosamine or something like that?
Yeah,
a little bit of that to maybe help the joints?
Glucosamine, chondroitin sulfate, fish oils are natural anti-inflammatories, but chances are for your animal they would be beneficial, but they wouldn't be enough. Okay. You know, because I think if she's having a hard time standing up and doing all that, then you know you got some significant either muscle atrophy, maybe neurologic deficits that have happened over time, and then just severe arthritis. You're going to need something a lot more potent than glucosamine, fish oils, nutraceuticals. So again, I would talk to your vet about that. I think that if you're really getting concerned with that, and if that quality and just can your animal enjoy life anymore, that's when you make that decision. Maybe one of the more potent anti-inflammatories, even though they could have some side effects, are worth doing, because I've had dogs that we risk it and say, okay, do we want to do this versus not do it, knowing their side effects, and they've lived longer because they've had better quality of life once you started it than having to make a decision before not using it.
When you think about it, if you want the animal to continue to live, I would much rather live a shorter period of time and be pain-free than to be in agony and live longer. That seems pretty clear.
And I think what we find, what we see, is that they actually live longer because people don't have to make a decision.
And it takes the stress off before they're not in pain.
Yeah,
the pain's the big thing that needs to be addressed, and I respect her for trying to look into that. And so see if there's ways to alleviate the pain and make it easier so the dog still gets some pleasure out of life.
And there's other pain medications, but they're probably going to cause some sedation. And that might make it a little confusing on how well quality of life is.
Tough situation what she's going through, some tough decisions for her down the road here. But wonderful that she rescued that animal and had a great life up to this point. Let's go to Laura. Hi, Laura.
Good morning.
Hello, good morning.
Good morning. What can we do for you?
I have 2 labs. They're approximately 6 or 7 years old, and they have hot spots on their ears. It bothers me to see the flies coming at them. Is there anything I can do outside of the spray to keep their ears from being so irritated? I think it's an allergic thing, because the doctor gave me some Benadryl for them, the Benadryl pills, but it's hard to get them to take them.
Yeah.
You got labs. You should be able to hide that Benadryl in any kind of food. They should be able to eat that. But I think it's a combination. It's hot. Yeah. It's humid. So you got allergies out there, so they're outside. Allergies can be a component of it. It can cause the skin to get irritated. It can cause ear infections, and the ear infections might be a component of it. The ears might not even have an infection other than what's happening topically, but most hot spots happen because an animal's scratching or chewing, depending on where it is, in that area. So hot spots around the ear are usually scratched. So you get moisture on the skin, the irritation happens, bacteria spreads. So if it's a hot spot, is there seasonal allergies that's going on? Is there an ear component to it that is going on, or is this only because they're outside, they got a little irritation, the flies are getting in, the flies are biting, and now you've got fly strike or the irritation from that, and they can really start gnawing those ears and make them pretty irritated pretty good. So some of the sprays, there are some topical salves. They're a little thicker. They can provide a protective barrier over that area. So you may want to just talk to them about that. A lot of the clinics will have that fly salve that can help. And the only way sometimes to truly fix it is to bring them inside, so the flies can't keep
them inside until the season changes.
Until the season changes, or until at least the ear heals up, and then you can go back outside. So I mean, they can go outside and pee and poop and go for a jog or whatever you need to do to get energy out of them. But staying outside for long periods of time, those flies are going to hone right into that and just keep trying to feed and bite on it, which is just going to cause continued reaction.
Okay, so take them inside for a bit. Yeah, you hear a lot of people dealing with that, and our beagle has contact dermatitis, stuff like that, and he scratches it, and the flies come around. It's a real pain. Yeah. Hey, by the way, in general, have you noticed, has this summer so far, in your opinion, been about par for the course for fleas and ticks? Worse, better compared to last year?
I think as far as fleas and ticks, probably about the same. I think we've got a lot better flea and tick medications now. There's a few oral products that have come out, and then there's a collar, a Seresto collar that lasts 8 months, and a lot of the topicals we've been used to for so long don't seem to do as good, or they're definitely not as good as some of the newer medications.
You like the pills a lot?
Yeah, I love the pills. They don't wash off, so if you're giving your animal a bath a lot, you're not diluting it down.
Again, the pill, and they take it and it comes out in their sweat. Is that essentially
and they seem like, it's just in that body, so, not necessarily as much like the old topicals that got in the sebaceous glands and secreted, but they work a lot better. So fleas, we still see fleas, there's no doubt about that. And then ticks, I think it's kind of about the same. There's some locations that have more ticks.
Let's see if we can we got like 30 seconds. Judy, do you have a quick question?
Yes, I have to take care of your dog from the fireworks display when it scares them to death.
You want to know how to do that?
Yeah, what do we do?
Yeah, it's crazy, isn't it?
Yeah.
You probably. Hey, real quick, we talked about it earlier in the show. We have 2 minutes. Just recap for them. The best thing to do to protect them from the sound, especially if they're traumatized now, like Liz may be.
Yeah, so main thing, if it's really bad and they're really destroying themselves or the house, you need to talk to your vet about some potential medications that you can use that day.
Doggy downers. Doggy downers.
If you know that it's fireworks only, then you can usually do something. There are other things you can do to try to condition, make it better, thunder shirts, some more natural products. But for the real severe cases, occasionally we do need some sort of anti-anxiety medication, tranquilizer, sedative. The whole goal is to calm the brain down and not just sedate the animal, is to actually help with the anxiety, and sometimes we have to use a combination.
Not to over-reward or over-coddle when this happens, so that it kind of gives them a positive reinforcement of this negative reaction, right?
Don't coddle, don't love on them, and do all that while they're having that stressful event, because then that's what they're going to be looking for, and you're positively supporting a negative behavior. So usually you can just kind of, if they're just shaking, allow them to be near you, but don't necessarily like have them up on your lap, or you know, be really like allowing them to love that time or need that time. So you know, just kind of have them be around so that way they're comfortable, but let them kind of wear it off. If it's more severe, then yeah, definitely talk to your vet.
Hope that helps. A lot of people dealing with that after 4th of July. And then, of course, it comes up again whenever there's a thunderstorm or something like that. Chad, as always, it's a pleasure seeing you, sir. Good to have you on. Take care of yourself. Be good to those animals out there. And we'll see you and Allison again sometime soon, all right? Take care. We'll take a break. I'll be back with a programming note about tomorrow right after this. Stay with us. That was great.